Ding. Well done. Well done. Okay, so I'm going to turn it, and if you would, just for housekeeping, everyone just keep your phone, your microphone on mute, just to help with any of the background noise. That would be really great. And I'm going to hand it over to Eric.
Thank you, Lucy, and good afternoon, ladies and gentlemen. As Lucy mentioned, we're going to go over the CARES Act funding, the CDBG CV, as it's commonly referred to. I'm going to share my screen momentarily and share with you some resources available from HUD. But the point of this session today is to maybe give you guys some ideas on eligible uses of these funds, because the city has, by my count, Joe and Lucy, at or about $800,000 in CDBG CV funding available, plus or minus. Don't hold me specifically to that number, but it's roughly that amount still available, right, Joe? Tracking that?
So we're roughly around that. This program right now is set up to expend around 300,000 of that, but also what we would point out is that at any point in time, we would love for this, and I know we're going to get into this further, but we would love to give this all away, because you're all partners with us in helping the city of Meriden out in responding to COVID and taking care of people and helping them get through this. So as of right now, we have 300,000 set aside for it. If the program does extremely well and there is some more need and applications in that warrant it, then Lucy and I would then go back to the council and say that we have another couple applications totaling X amount of dollars, and we can go back after it. We've already given out roughly 200,000 in small business loans, and we are looking to do some other programs as well. So Eric is right. Roughly we've received a little over $1 million in total for CDBG CV. And given out close to the 200, and then there's 300 set aside for this, and we'll go from there. But thank you, and again, I'd just like to say thank everyone for coming this afternoon.
Thanks, Joe. So as a little bit of background, the CARES Act was passed by Congress and President back in spring, early part of 2020. And the CARES Act, as it relates to the HUD funding, the CDBG funding, allows us to actually reimburse for expenses all the way back to January 21st of 2020. And the big caveat is there's three things that I'm just going to keep harping on today. These funds, number one, have to be an eligible CDBG activity and outcome measure. And I believe that most of you are agencies that have received CDBG funding in the past, so you know the general scope of eligible CDBG programs and expenses. We have an additional caveat to these funds that they must meet one of the three criteria as it relates to COVID-19. We must prepare for, well, COVID's here, right? So there's not a whole lot of preparing for, but prevent or respond to the impacts of COVID-19. Prepare, prevent, or respond. And back last spring when HUD published this, we were all thinking, hey, we're going to need all these plexiglass screens. I see some of you have masks. There was a shortage of these things. So we all thought we needed money to buy hand sanitizer stations, plexiglass to modify our workstations or our intake stations, etc., masks, gloves, etc. So I think once the supply chain caught up on all those things and it became so much easier for all of us to get that stuff, we kind of just said, well, we're responding and we're functioning. So I don't know what we need this extra CV money for. What I'm going to show you, and I'll make sure everybody has a link in the chat, and we can get Lucy to email it out to the group. But I'm going to momentarily go to the Hud Exchange, which is HUD's website, Hud Exchange. And you can simply Google that. I'm going to take you to the CDBG CV page. More specifically, I'm going to take you to a notice that HUD published just this May. And the title of that notice is Additional Flexibilities to the tiebacks, and this is what they call tiebacks to prepare, prevent, or respond to COVID-19. And what you'll see is it is far more expansive, the eligible uses of these funds, far more than just getting PPP and making some minor modifications to your workstations, etc. So some examples of applications that Meriden has seen this summer. There was, maybe this is one of the agencies that's in the room, but an agency needed to provide their youth mentoring program, summer camp programming, some of that stuff remotely. And so case managers needed better laptops or computer stations. Obviously, we all have cameras now, but cameras, microphones, and maybe it's even just paying for subscriptions to better software, towards a full subscription of Zoom or things like this. Those things are eligible if your program that you're offering is an eligible CDBG activity. So youth programming, summer programming, financial literacy, all, some of these things that I know agencies in the room offer, you're basically not able to offer them in the normal setting. And so now, because of COVID, you've got this modification to make. And so the eligible use of the CV funds helps you deliver what was already an eligible activity, but in a manner that properly prevents further spread, right? So prepare, prevent, or respond. So we're meeting that prevent by doing social distancing, video conferencing, etc. We can, of course, still help you make modifications to the setup of your facility. I see a lot of you appear to be calling in from home, as am I, but to the degree that your facility needs partitions, different furniture arrangements. An example of an activity that HUD's used repetitively is different libraries had basically shut down across the country because and have the ability to keep up. So sanitizing stations and having janitors or cleaners there that could help clean up stations promptly after different patrons came in, but also just different arrangements and furniture types so that the surfaces are more easily cleaned and sanitized. That again is a rational modification or expense to a public facility to further prevent. On the recovery side, I think a lot of us could benefit from recovery, and I really feel like this is probably what will most interest you. A lot of nonprofits, of course, rely on donations from the community to be able to provide their programming. And so now you perhaps have had additional expenditures dealing with COVID, additional demand for your services, but a decrease in donations. So your operational budget is more expensive and less revenue. So you've had an economic impact, a financial impact on your organization's ability to deliver your CDBG eligible programming because of COVID. And so if you can document the financial impact and effectively your agency's potentially inability to offer your programming at standard levels because your financial impact, then you could document that, and CDBG CV could help your organization financially recover from the impacts of COVID, just so you could get back to your original sort of baseline programming and services. So if you've had, again, increased expenses or decrease in revenue, or of course the combination, and you could document that, then that would substantiate. Now, again, the use of the CDBG funds, it's not like the city can just write you a check for $50,000 and say, hey, we're sorry you had a bad year. You still would do as you do with your ongoing CDBG programs. It would help you with rent, utilities, supplies, salaries, etc. moving henceforward. But also, I want to go back to where I started. The CV notice allows us to go back all the way to January 21st of 2020. So if you say, look, last year we had to bring on 10 additional counselors because when we offered our program and we had to do it in small groups, for example, and so we had to separate, we need additional janitorial services. We used to do it once a week and now we do it every night because we needed the whole building sanitized, things like that. You could actually say, hey, these are expenses that were eligible, further impacted our ability to continue offering services. And you could ask for reimbursement of those expenses that you've already incurred while delivering a Cdbg eligible public service, which I believe all of you have been doing and are ongoing with those kind of things. So there's a lot of opportunity here, and I won't be able to share with all of the examples. But before I switch over and just show you where the resource is, so you can maybe read through and think of things that might be relevant to your organization. The Federal Register, where Congress publishes the rule for HUD on how to use this, they specifically state that they will not identify eligible activities that prepare, prevent, or respond. They wanted to give the local jurisdiction, in this case, City of Meriden, that ability and that flexibility to make that connection. So HUD's even saying we can't fathom all the connections that could be made here. We're not going to limit that. So you're not going to see a list that says these things are eligible or ineligible. I'm going to show you some examples of things that HUD said these are definitely eligible. But what we'd like to do in some of our time today is, if you have ideas, we can discuss the potential of those making that connection, and then certainly Lucy and I can be available to you to discuss an idea that you might have, and how we can make the proper connections and eligibility. So with that, I'm going to share my screen here, and I know that's going to kind of shift everybody for a moment, but I'm going to take us to the HUD Exchange and just show you. I'm not going to read to you, but show you just a few different pertinent sections. Make that a little bigger on my screen. Hopefully that zooms in. So again, hudexchange.info is the website. And for those of you not familiar, if you just come here in the menu bar to programs and then Cdbg, and I'll do that and just show you. Then right here at the beginning, or right in the main part of that screen, is Cdbg CARES Act, and click there. So here's all of the resources that are available, all the guidance, all the various webinars, publications, etc., that HUD has already published. We're more than a year into this. Of course, this was authorized, as I said, back in last March. So we're more than a year into it. But lots of resources here down at the bottom. Some FAQs that have already been asked and answered. And I am a responder on those ask a question, so I can definitely point you to the right answers. And then some other resources for the city. And then I'm going to take you specifically here to this PPR, Prepare, Prevent, Respond, Tie Back Flexibilities, this quick guide. This is what I was referencing, was just released in May of 21. So again, it's still on the HUD Exchange. You can link to it from that previous page I was on. And then here's the PDF that actually shows up. So this, I would encourage you, if you're contemplating, not sure if you have some sort of eligible use or expense, but would like to make sure you've exhausted all options, I would encourage you to come grab this resource and take a read through. And when we get down here to what I believe most of you would be doing is the public services. And so, as Joe mentioned in the onset, the city's already running directly an economic development program, helping small businesses essentially stay afloat and retain employees through this situation. But here's some public services. And these are just examples. So don't take this as this is the only thing that's eligible. But I mean, they're talking about job training efforts and neighborhood revitalization, capacity building of even daycare centers, right? So that parents can work and rejoin the workforce. Equipment, supplies, etc., necessary to carry out public services related to the effects, etc. There we go. Testing, diagnosis, vaccination, etc., other health services. I know there's a few of you that kind of do those types of things. If you wanted to set up testing locations or vaccination centers, those things would be eligible. And then I believe the state's running a emergency rent, utility, and mortgage assistance. So that might not be relevant here, but that's a real popular one as a public service. And I'll also show you, for those of you that own your building and can classify that as a public facility. I know we talked about that in our previous CDBG application cycle, but here's some options about public facilities. And a big one that's really popular right now, I'll point out to you, is rehabilitating community facilities, community centers, parks, libraries, nonprofit community centers to improve ventilation. There's some science out there and findings that suggest that improved ventilation, just improved airflow, but also air filtration helps to minimize the impacts and prevent further spread of COVID. So you need a new HVAC system in your building. You could make a connection here to improved air quality for your patrons. So some other options here about improving your public facilities, all kinds of rehabilitation, et cetera, of public facilities and other public buildings that are eligible. So again, I won't necessarily read these to you, but this could give you some ideas and show you how wide or how extensive these flexibilities truly. The title of this is Additional Flexibilities. So I'll make sure that these get shared with you afterwards. But if I can here conclude, and then we'll open it up for questions. But for those of you that might have thought that this was only for hand sanitizers and gloves and masks, it is. That's not it at all. And we probably would discourage you from applying for just funding that because those things are such readily available at these times. But if your organization's been impacted financially, either loss of revenue or increased expenses, and you can make that connection that COVID had that impact, and you're offering community development or CDBG eligible public services, which we know you are, then right there you could apply for assistance to recover from that impact. And my hunch is that would be the most popular, if you will, option for all of us. But others might be interested in making some much needed repairs to older community facilities to help out as well, other modifications. And certainly, look, if you still need plexiglass and stuff, you're going to be reopening, but you're concerned about the Delta variant this fall, certainly making modifications, even if they're temporary modifications, is still eligible. So I don't want to just say flat, we don't want that, but I venture a guess that most of us have already done those temporary modifications. So with that, I'll stop. You feel free to type a question in the chat, or if you want to just wave at us, we can come off mute and ask a question. I'd be happy to just have a discussion with you about any ideas you guys might have or questions.
I'm Gretchen.
Hi, Gretchen.
Hi. Yes, I think I met you once before up at City Hall, actually.
Yes,
I think you did a presentation. Yeah, so I guess my question is, what is the next step for some of us that have submitted, an application? What is the next step for us? Do we need to do something more as it relates to what you've just told us?
Well, yeah, so thanks for good segue, Gretchen. So the city has published, and it's available, correct me if I'm wrong, Lucy and Joe, but it's available online on the city website, a specific CDBG CV application. And Joe mentioned that we've received one or two, but this is a different application. Doesn't look a whole lot different, but it is a separate application from what you submitted not too long ago for your quote regular annual funds. So this would be a specific separate application for CV.
But some of us did submit that already.
Yes,
I mean, I know that there is the regular CDBG that we did, but then in order to even qualify, it was my understanding that we had to submit an application and it was first come, first serve. So I just want to make sure that there isn't something else that we need to do.
Yeah, so I've helped Lucy vet those. I believe there were 3 of them. She and I reviewed them a week or two ago. a couple of those applications looked pretty straight away that they were eligible. And another one, and we won't necessarily pick on any of them on the spot here, but one was an eligible activity, but didn't make that connection. And while Lucy and I could probably surmise the connection, we need you to make that connection in your application so that that's what we're approving, right? And from a HUD's perspective, they want to see the connection made in the application so that when we vet it, we say this is eligible and makes the connection to COVID. So when Lucy's going to provide feedback to those agencies that have already applied. We need some tweaking. I don't think anybody will be just flatly denied, but there's need to be some tweaking to how the connection's made, which kind of prompted us in those reviews, and the fact that we've only received 3. That's what prompted us to have this conversation with everybody today. So those of you that have already submitted, Lucy will be in touch, and you might have an opportunity or may want to take the opportunity to take a second look at your application and modify it and resubmit perhaps.
Do you want to speak at all as to the reporting requirements?
Yeah, absolutely. So the reporting requirements will be very similar, if not identical, to your CDBG programming. So you've got to be still delivering a CDBG eligible activity. So if you were receiving CDBG annual entitlement funds to deliver a youth program, for example, and the CDBG annual funds paid for salaries, well, we can't, the salaries have already been paid, right? So the CV funds could cover some other expense that has not yet been covered by some sort of grant program. It come out of your pocket, or you're looking towards this next year to this fall to say, hey, we've got to downsize our programming because of this. Then you could modify. So basically, you're still going to deliver a CDBG eligible public service. You might just have the opportunity to add more money to that your annual entitlement fund to cover COVID related. So still, who participated? That's primarily low to moderate income households or individuals have to be the beneficiaries of your programming. If those of you that consider a public facility, of course, the patrons of your facility need to be primarily low to moderate income residents of Meriden. The beneficiary forms, Lucy and I are going to be modifying the forms you've been using, not dramatically, but we're going to modify your beneficiary report. And again, when you submit your invoices for the CV funds, we will have already in your scope of work made the connection that these expenditures on whatever it is, these expenditures prepare, prevent, or respond to the impacts of COVID on your organization. And so the invoice will still have the same backup documentation. If it is in fact salaries, then you're still just payroll and proof of canceled checks from your organization, but we're making that connection. So again, real simple example, because of COVID protocols, you want to have your classes smaller, or you want to have more counselors so you can spread out and have smaller groups. So you need 5 more counselors for this fall series. Okay, well, those additional counselors are still just salaries on your programming, but you needed to hire them because to properly prevent the spread of COVID. So it's really the activity we're looking at, probably not much different if it's a service. Does that make sense?
One of the things to also remember during all this is that CDBG is a reimbursement program. So this is not something that we would give you the 10 and then you'd spend it. You've actually spent it and then are asking for a reimbursement for it. So it's just to point that out, that's very similar to what you've normally received. So, and I think we'll go back just a second. When we were looking at setting this up and we did pick the 300,000 number, the reason why we went to 10,000 and nothing is telling you that, nothing is saying that you have to ask for 10. If you have a need that is less than that, please put in for that. So if you have something that's for 2,500, please do that. This is not saying that you have to add everything up and a wish list that you might not be able to get to get to 10,000. If you have 2 items that equal 5, by all means, put it in. What we did is we picked the 10,000 of a maximum number because we want to spread this money out amongst as many of you as possible. And that is what we are really trying to do. We are doing this on a first come, first basis. We thought that that was the fairest way to do this. And, you know, we've gotten these applications out, and today we have this program here to help you and guide you through that. So what I would do is get in the application as soon as you can, and we will notify everyone when we have either reached our maximum goal or when we need more applications, whichever it might be. Again, I'd also like to point out, send in your need to us, even if we've closed down and we've gone through the 300,000. If you send in your need to us, this gives us, Lucy and I and Eric, use a not so popular word, but it gives us it gives us a way to go to the council and say that there is more need out there for this. We have some more programs that people are looking to do, and this would be a good way to spend some of our funds that have not been at this moment earmarked to any one particular group or function. So I'd like to point that out. So right now it's open until we have spent all of the 300,000. And again, I encourage you to get it in for as little or up to the 10. We're not saying you can't ask for 10 if you're in need of it. And all the things that you're requesting fit into everything that Eric's just mentioned, then you'll be granted for it. But if you only need 5 for something, then ask for that.
So will you be taking multiple requests? I mean, say we have 2 that maybe are for 10 and let you guys ultimately decide which one you like best, or if there is additional funding, or would you prefer 2 $5,000 requests, 2 different type of programming? Can we do that? Or is it just 1 at 5,000? I guess those are my questions.
John, I think that the amount that we can go maximum up to an organization is 10. If you feel that you have capability to fundraise for more things, and you're looking for 5 for each to get started, and then you're going to fundraise to get the other 5 for each one of those 2 programs, then definitely you can do it that way, or look at it in another light and say, okay, if I fully fund one of those things I'm requesting, then ask for it. I would say to you, we are going to cut it off at 10 per organization, but if you have several things that you could ask for, send it in to us and just realize that we can only go up to the 10 number, and we would stop there. But as I just mentioned, if we have a lot of need for more money, I mean, everyone knows here that the city also receives some other funds that we'll be distributing later on, not through this office, but through the city manager and the council. You can always ask for things up there as well, but send in the requests and we'll keep them on file. You'll only get the up to the maximum of 10, and we can go back and say, okay, I've got another $40,000 or $50,000 that we're looking for from our participants. I think that this is worthwhile. Then Lucy and I look at it, and Eric, and we go, okay, all these that have already been sent in could work. We would probably reopen up the program so everybody knows, because we want to be fair and transparent about it. We'd reopen up the program. We'd already have your applications in from before. We probably set it up with a little more money than what we have in a request, so we can take some new ones if people have it and go from there. So,
thank you.
Yep.
Thanks, Joe. I've also, for those of you in the able to access, I know some of you are on the phone, but I put in the chat a link to the city website where you can find it, and I'll show you just real quick. I'll share my screen. My hunch is you guys know where to find this because you apply for annual funds, but nonetheless, let me just show you so we're all sure. On the city's website, on the government page, and then you look at Community Development Department, and then you see here right at the top the Community Development Block Grant CV. That's the notice and the program rules, if you will. And then the next link is the actual application, which just opens up our fillable PDF here. Okay. And again, that's on the chat. And if you have any trouble accessing that, of course, you've got Lucy's email. She can get you a link to it, but it's right there on the city website.
Great. We have another question in the chat, Eric, that I'll read to you. If COVID caused our program participant numbers to go down, could these funds be used to provide outreach efforts to bring back more participants?
I would think so. So you would, and again, I'm just trying to make that, you would need to narrate, Lou, that you would need to narrate why COVID kept people away. And so that you have now made adjustments, whatever, so that the programming can be offered in a safe manner with COVID protocols. And so you want to promote, if you will, for lack of a better term, do outreach to let people know that the service is in fact still available and we have safe protocols in place so that people feel comfortable accessing whatever that service might be. So certainly, that seems pretty rational to me. And at the end of the day, if it seems rational to the group here and the council that approves the contract, then HUD has specifically given us that authorization in the federal notice to make sure we make that connection and rationalize that connection, prepare, prevent, or respond. So that seems like a response, certainly.
Great. Okay. If there are any other questions in the chat right now, I will ask you to just expand on one little thing for us, Eric, before we disconnect. So you're talking about like making the case, right? Making the connection between the need for this additional funding and some financial strain that the organization has had. So we're talking about what is making that case look like? Is it them saying, okay, our fundraising dropped 30% last year, and this is directly related to COVID? Is it just showing like some financial spreadsheets that's showing the difference between the revenue and the expenses? What would be appropriate?
That would definitely be appropriate if you're suggesting that your organization effectively has had a disruption of services because of the financial impact. So you're just you would say, hey, our offerings, and as literacy volunteers, Lou just mentioned, our offerings, our participation rate has gone down. Well, why? Because COVID, because we're not offering it as many nights a week, because we had to cancel, and now people still think we're shut, whatever. So yeah, you would document that sort of pre-COVID. Here's what we look like. Here's our typical revenues, our typical staffing capacity, our typical program offerings and participation rates, etc. And then say during COVID, for some of you, the revenues might have gone down, but my venture a guess that some of you saw a significant increase in demand for your services. I know that we have a couple soup kitchens and things like that, emergency assistance, utility assistance, those things. I'm sure you saw an increase in demand for your service. So you could just say, hey, we keep asking you, city, for 20 grand every year. That's what we get to offer these services, but we had to double our offering because of the demand due to COVID. So you could say, hey, we've had increased demand for these services because of the impact on the households that participate in our program. And so we've had increased expenses trying to keep up with that demand. And again, pre and post or pre-COVID averages and current during COVID averages, etc. Could be helpful. Again, I would point out that some of you may have taken it out of unrestricted or general funds, that however you refer to those, and covered those expenses during COVID. And so you might be looking backwards and going, yeah, over the last year, we've had an increased expense, a decrease in revenue. For us to be solvent in able to maintain our capacity moving forward, we need help with expenses that have already been incurred, paid for, so that your agency, just to be blunt, your bottom line doesn't look as good as it might have a year ago pre-COVID, and that you might just be asking, hey, can I get some help with reimbursing what now is obviously eligible expenses that we took on last year to keep operating? But if we're not able to recover some of that, we're looking at some hard decisions moving forward. I certainly have worked with nonprofits that have unfortunately had to cut hours, cut days open, cut staff, et cetera, because they took on these expenses and didn't have a way to recover the funds. So if you're in that boat, that might be something it's not something you're going to look to provide. It's need help recovering from what we did provide. And again, we can go all the way back to January 21st of 2020 with those types of expenses. You would have had to have been offering a CDBG eligible service during that period. Again, I think all of you likely were and received funding during that time from the quote regular program. But that might be a good connection for you too.
Don, I see you have a question.
Yeah, sorry, I did see that, Donna, raise your hand.
I thank you for the opportunity to help the community. I just wanted to go on record and say that the community development block grant money, the regular money, that was the only money that was available that a household could get rental assistance that was not impacted by COVID. So all the dollars that are out there, unless you get, you know, a small grant from a foundation, is restricted to being able to document that they are COVID-19 impacted. And so we have been able to use our regular CDBG money to help that household. For example, they're finally getting into subsidized housing and they need to pay the 2-month security deposit. So we can pay from one place here and one place there. So is this this new pot of money, is that something that could be considered, or do they have do the households have to be impacted again by COVID-19?
Yeah, so if you're providing direct financial assistance to households, then yes, the households need to document their COVID impact. Now, when you reach that tieback flexibility that I was sharing earlier, the HUD has slightly modified that language, and so has the Treasury on the Emergency Rental Assistance Program that the state's managing. It's an impact during COVID. So my household doesn't necessarily I don't have to say that somebody got sick and was laid off. But if we had increased expenses or of any kind, like just because my kid was out of school because schools were shut down, I had increased costs of daycare. I mean, that's one of the examples HUD even uses in the guide I showed you, offering free daycare or reduced so that parents can get back to work. So if I think a lot of times households thought, well, nobody in my house got COVID. Nobody got fired because of COVID. Well, we weren't impacted. But I think at this point, I think every household in America could say that they were impacted during COVID one way or the other, right? And so CDBG and that guidance, that addition, again, the HUD term, additional flexibilities allows us to be a little bit more liberal in our approach to what that means when we're helping direct financial assistance.
Thank you very much.
And I'll add to that, CDBG allows for self-certification. So I don't need documentation that the household was impacted. Let's say that, that I had increased childcare in that example. Like I don't need them to show me canceled checks where they paid childcare. Somebody can just say, look, my kid was typically in daycare for a couple hours after school, and now they've been in daycare all day. So it was 5 times expensive every week or whatever. Like they can just tell you that in an application. I don't need to push them to go get paperwork to substantiate that. Tom, did you have an additional question? I saw that maybe piqued your interest.
No, just I'm on the committee that's reviewing this with Joe and others. The other thing I was going to say is that in looking at some of them, it wasn't very clear. We had to kind of read through the lines on some of them. One of them was very good, but we had to read through the lines on the COVID impact. So please just be as clear as you can on the application so that we can make that connection. And the thing that troubles me a little bit is these requirements, and the self-certification process that you're talking about is new to me. So that may be more helpful in our discussion. So I'm sure you'll hear more about that later. Thank you.
Absolutely.
I'm going to have to leave now. I've got another meeting that's about to start. So thank you, everybody.
Tom, sir. Gretchen, did I see you wave your hand again? Anybody else?
There is another question in the chat, but I'll read to you, Eric.
Okay, go ahead.
We have multiple buildings that require HVAC systems needing to be installed. Do we submit one application or two? So I'm guessing that they should submit one application for all of the buildings, but again, it can't go above 10,000, correct?
If it's on the same property, one application. If they're different addresses, I mean,
Okay,
truly different locations in town, then separate applications. I'm just thinking from a contract and environmental and Davis Bacon and all that, HUD would look at that as two things. So eventually it would be if two buildings, one piece of property, one application, one contract, one scope of work. Two buildings on two separate pieces of property across town from one another, that would be separate. And those of you that might consider something like an HVAC, what you'll want to do, and my hunch is if you've even started looking, all the HVAC companies are already promoting their various filtration options that help reduce all kinds of different spread of not just COVID, but other, flu and colds and all this other stuff, right? So you'll want to highlight that will effectively, that needs to be in the scope. So down the road, I'm thinking ahead here, but when you sign that contract with that HVAC company and the scope of work says they're going to install some size HVAC and how many ever vents and whatever, and it's going to be at this building, blah, 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 that the specs of that HVAC system needs to include something from the contractor that says this level of filtration will help mitigate or reduce the spread of viruses. And they're all doing that right now. And I think the science is already saying just improved airflow is at least an improvement, but you'll want to make sure that that's in the scope. And I'm thinking that 2-3 years from now, when HUD finally comes and audits the city on this, it'll be easier for all involved if that HUD rep can look at the scope of work and go, yep, they did it, air purification improvements, that was clearly eligible, and they'll move along without pestering us too much.
And just to piggyback on that statement about the applications, and that's because of David Bacon clearing everything up for us, but it still has to be, to get funding for two different situations, it still has to equal maximum number of 10, because it's the same organization. So even though it's location A on the west side and location B on the east side, still, and it's the same organization owning both, it still can only equal 10. And again, as we talked with John earlier, if you have more requests and you want to send it in to us, but know that you're not going to get it on this round, then we would look at it for further round and further funding later on.
that's great. There are no other questions in the chat, Eric. So we did put the links in the chat box to the tiebacks document that Eric showed earlier. And then we also added in there the link right to the application. And then shortly after, later on today or perhaps tomorrow, I'll send out an email with just a recording from this so that you all can go back to it and refer to it or share it with your colleagues if anyone didn't have a chance to attend. This type of gathering right here is something that I'm looking to do more of with all of you. So if there are ideas or suggestions or themes or things you want to learn more about, please send to me a note or give me a call. And I'd love to chat with you more about that and see how we can help. But in the meantime, we're here. And if you have any other questions about the application or this funding opportunity, or if you want to talk with us individually before you submit, we're happy to be here and be a source of support for that. All right, everyone, thank you so much and enjoy the rest of your day.
Thank you, Lucy.
Take care.
Thanks so much.
Thank you, everyone.